once again. We're back for another monthly session organized by the Data Ellis Company for educating practitioners and the public on aspects of bioresonance and energy medicine. Today, I will be talking about bioresonance diagnostics. Some of the material will be very easy to understand. Some of the material will be more geared towards practitioners who are interested in learning more about bioresonance diagnostics because it is a very confusing field. Let's just look at the basics of the body's control systems. Incredibly, we have in our bodies over 6 trillion cells, and each of these cells have more than 30,000 chemical metabolic processes occurring each second. This totals nearly 200 trillion reactions per second. So the question is, can all these metabolic processes be controlled by the nervous system and the hormonal system of the body by itself? Or perhaps there are other systems involved. The systems that are more esoteric, because these are physical, they can be looked at anatomically, physiologically. But to look at the other systems, the other control systems, we need to look into the field of energy. And indeed, we know that each and every cell of our body emits some sort of light. Professor Pop's work, he called it biophotons. There's also electromagnetic fields, thermonuclear emissions, again, are emitted by each cell. And then we have whole energy systems in the body that Ayurvedic medicine over 7,000 years ago knew about, the chakra energy systems. The meridian systems that the Chinese knew about more than 3,000 years ago. We also have a cellular electrical system. We'll talk a little bit more about that because that's also very interesting. And then, of course, we have the physical systems of the nervous system, the brain, the muscles, the connective tissue, the biomatrix or the connective tissue, which forms a matrix connecting each and every cell, cardiovascular, the heart, and of course, we will also have the level of consciousness. This was a video that we did last month, talking about how thoughts, beliefs, the mind, the level of awareness, how open our heart is, can also affect our health on the level of physiology. In a complex living system, the trillions of living cells function individually, but also as a whole by an innate intelligence. No one really understands what type of intelligence can control and harmonize homeostatically trillions and trillions of cells every second. To act as a whole, living cells must maintain continuous, coordinated exchange of energy and information from cell to cell across the entire organism. Interestingly, scientists have found that the epidermis of the skin is the same tissue as the cerebrum of the brain. So whatever is stressing the skin and the autonomic nervous system will be sending messages to the brain, which will then be processed, and there will be consequences. So we can tap into the autonomic nervous system by testing the skin. This is probably very familiar to kinesiology practitioners or autonomic response testing practitioners, or bioresonance diagnostic practitioners using what is known as biodermal screening, where they're tapping into the acupoints on the skin and eliciting information from the body by doing this. Let's have a brief history of bioresonance and energy medicine and electromedicine. We can go all the way back more than 2,500 years before Christ, where in Egyptian tombs they had found depictions of the fish species Malopterus electricus. There were several descriptions of therapeutic benefits, including pain control from exposure to the electric eel. This was the electric eel. It was also described by the Greeks in the 1st century. If we come to around 1600, William Gilbert, an English physician, coined the word electric and established a difference between electricity and magnetism. In 1752, Johann Schäfer published the book Electrical Medicine. By that time, many physicians were reportedly using electricity in their practices. And you don't have to go very far. You can just Google or look up on eBay for antique electrical therapy devices, and you will find many of these devices that were used by these practitioners. This was all the embryonic stages of electromedicine. And then in 1830, Carlo Matteucci, a professor of physics at Pisa in Italy, showed that the electrical current was generated when tissues were actually injured. And we will see more about this, we will hear more about this, because in order for the body to regenerate injured tissues, it needs to increase the voltage from around about minus 25 millivolts to around about 50 millivolts. The body needs to increase that voltage in order for it to regenerate these injured tissues. In 1858, Dr. Francis, a Philadelphia physician in the US, was the first to describe the relief of dental pain by electricity. And after 164 successful tooth extractions using galvanism, which was a term used for using electromedicine, Dr. Francis received a patent in 1858. And then after the patent, in the middle of the 1800s, these methods began to spread throughout America and Europe. And in the same year, Oliver Buffalo claimed the discovery of electrical anesthesia, where he reported a 98% success rate using a vibrating generator for dental pain. So this, again, was a real eye-opener for many physicians of the time that didn't have much knowledge in the use of electricity therapeutically. In the same year, Harding at the University College Hospital, London, confirmed Oliver's results with studies of 40 tooth extractions. So now we're getting scientific papers from the UK confirming the efficacy of electromedicine in tooth extractions, particularly. By the late 1800s, the use of electricity in medicine was widespread and described in such medical texts as Osler's Practice of Medicine, which was one of the Bibles of medicine at the time. At the turn of the century, there were many natural products and electrical devices being advertised by snake oil salesmen. And indeed, there was chaos, because the snake oil salesman took this opportunity from these scientists that had worked in the field to have a field day, make a lot of money by advertising that a lot of these devices were curing everything. It was a panacea for everything. And of course, the pharmaceutical companies at the time that were more interested in making profits from chemicals and pharmaceutical products, they didn't like the widespread advertising of these electromedicine devices and natural medicine in general. And then instead, the Carnegie Foundation, who established a commission that was headed by Abraham Flexner. And electrotherapy became, unfortunately, a scientifically insupportable technique, and it disappeared from medical practice. The Commission's final report was published in 1910, and it produced an almost instantaneous revision of medical education. A lot of natural medicine practices, a lot of homeopathic schools, naturopathic schools, herbal medicine schools, and a lot of the electromedicine that was used at the time just literally went underground and disappeared. So the Flexner report in 1910 did a lot of damage to natural medicine and electromedicine. Doctors using electro instruments of any sort were branded as quacks and charlatans. Nothing much has changed, because this is also the approach of modern medicine today. And in the backlash of this mindset, electronic devices of diagnostic or therapeutic value have been very slow to be accepted. And even now, there's a lot of suspicion surrounding the use of electrodiagnosis and electrotherapy, even though there are many open-minded medical practitioners now that are interested in studying energy medicine and bioresonance. I know that for a fact because in the last group that I taught here in Cyprus on bioresonance diagnostics and therapeutics, over half of the group were medical practitioners. So it's pleasing and encouraging to see that there is a paradigm shift eventually for medical practitioners to begin looking at more natural approaches to healing and diagnosis. Now, even though after the Flexner report, a lot of these electrical, therapeutic, and diagnostic devices began to go underground and disappear, there was still a lot that was being discovered by few researchers that wanted to continue researching electromedicine. A famous researcher, you can look him up on Google, and also you can see some of his videos on YouTube. It was Jerry Tennant. Now, he showed a relationship between pH and healthy cells or disease cells. He also correlated the pH of the cells with the voltage of the cells, because each and every cell does have a voltage. So if we go to an extreme pH of 0, which is of course very, very acidic, then the voltage will drop from minus 20, 25 millivolts, which would be the normal healthy cell, which is functioning at a pH of about 7.3, 7.35. It will drop from the minus 20 millivolts to plus 400 millivolts. At a pH of 7, which is about neutral, the cell voltage is pretty much 0. At 7.35, which is the state of a healthy cell, and of course blood and blood plasma has a pH of around about 7.35, the voltage, as I said, is around about minus 20 to 25 millivolts. At the other extreme of the spectrum, which is alkalosis or an alkaline environment, pH 14, the cell voltage increases to minus 400 millivolts. So anything that increases the voltage to plus 30 millivolts or more, then that cell can be classified as a cancer cell. Cancer cells have been measured to run around about 30, 40, 50 millivolts from the minus 25 millivolts, which would be a normal cell. So the minus sign means that the voltage of a cell or substance makes it an electron donor. Thus, it has life and energy to give out. If the voltage of a solution drops to the positive side, it becomes an electron stealer, robbing cells of their life force, and that's exactly what cancer cells do. Because they have dropped to the positive side, they're electron stealers, and they will steal electrons from other cells and weaken them. Normal human cells, as we've mentioned, which have a pH of 7.35, have a voltage of about minus 20 millivolts. So let me just repeat this because it is important. As the voltage in the cell drops, going from the minus 2025, which is normal, to 0 millivolts or a positive voltage, the cell becomes compromised or sick. And it's interesting to see that pH and voltage literally run on parallel lines. We don't really need to measure the pH using a pH meter. We can just simply measure the voltage, and that will give us, in very precise terms, the pH. So normal cells run at minus 20 to 25. However, in order to regenerate cells, to heal cells, we need to increase that voltage from the minus 25 to minus 50 millivolts. If the cells do not have this potential to increase their voltage, they cannot repair themselves. That's another interesting fact. So chronic disease occurs when voltage drops below minus 20, or you can't achieve the minus 50 millivolts to make new cells. And interestingly, Tennant says that chronic disease can almost always be defined as having low voltage, low body temperature, low pH, occurring in conjunction with low carbon dioxide and oxygen levels. So if you have all of those factors running concomitantly in the body, then that is setting the scenario for cancer and other degenerative diseases to take hold. Now, low voltage also means that nutrients can't cross the cell membrane and waste cannot leave easily. Once the voltage is restored to the tissues, the intracellular pump starts working, nutrients enter the cells and waste leave. The cell's pH becomes balanced, the oxygen supply to the tissues improve, and inflammation decreases. In short, you have optimal cell functioning. Now, isn't it interesting that the topic we're talking about today, bioresonance bioresonance diagnostics and bioresonance therapy, of course, which go hand in hand, can help increase this voltage or the transmembrane potential of the cell to help it do all these and reach an optimal cell function. There's probably not much else in medicine that can increase the transmembrane potential of the cell, the voltage, as effectively, efficiently, and quickly as electromedicine. Chronic disease is always associated with the loss of voltage, and so are acute disorders. Healing demands that we get enough electrons to push the cells back up to a healing voltage of around 50 minus 50 millivolts. Our bodies and cells also need to have enough raw materials, nutrition, to also get better. But nutrition without voltage does not work. And obviously voltage without nutrition will get one nowhere too. So the nutrients are equally as important as the voltage or the transmembrane potential of the cell if we want to optimize cell functioning and instigate healing. Now, how can we raise the cell voltage? Well, the Russian company Diagnostic has done a considerable amount of research over a 20-year period and found that it is possible to raise cell voltage and obviously achieve some form of healing, improving the pH, the oxygen, the nutrients that are getting into the cell by using bioresonance therapy. And the beauty is that they have packaged the bioresonance devices into a small device, no bigger than a mobile phone. I have a new device just here. I'll just put it in front of the camera so you can see. This is the Vita, which is designed for upregulating organ systems. You see, it's no bigger really than a mobile phone. It's also programmable. You can program it using a small USB device, which is called the Deinfo. It's that one. This actually contains more than 3,000 different programs. And this is one way of obtaining optimal health of cells by increasing the transmembrane potential. And we've already looked at the theory of how important that is. So as the voltage of the organs increase, so does the pH improve, the cells, the ability of the cells to regenerate, because now they can produce the minus 50 millivolts that are required for cell regeneration. And basically, once the device is programmed, it sits in your pocket. It has an antenna on the back of the device, which emanates the electromagnetic fields. And as long as you have the back of the device on your body, you can actually put it under the pillow, or just simply have it in your pocket, or just hang it around your neck in a special case that the company also produces. So it has 1,500 possible programs. This is the older, better Ritme that we're looking at here. I didn't have time to find the new image of the device, but I'll show you again. This is the Vita Ritme. The difference is that this one has 30 memories, so you can it comes with pre-installed 30 programs, whereas the older one had 13. It runs on 2 AA batteries. You can also string the programs together. So by pressing one button to run, it will just keep on running all those programs that you've stringed together. Now, the Russian company Diagnostic did many different trials. In fact, there were 117 clinical trials, and they looked at all these types of disorders: endocrine disorders, hypertension, angina, tachycardia, all types of renal problems, kidney problems, gastrointestinal problems, respiratory problems, asthma, bronchitis, pneumonia, headaches of all different types, gynecological problems, including prostatitis with men. They did a very large study there and found an incredible healing potential of using the Vita Rhythme, and also the Vita app. This is a second device which is antiparasitic and is used for eradicating parasites, bacteria, fungi, viruses, etc. And that's also programmable. So these small devices, which of course have a lot of potential for development, for further development, really can play a very large role in optimizing the efficiency of each and every cell of the body by increasing the transmembrane potential, and therefore balancing pH, increasing the voltage to the normal voltage or the regenerative voltage that the body requires. Now, to look a little bit at the diagnostic side of bioresonance, because that was the therapeutic side of bioresonance that we just discussed, utilizing these small DeVita app and Rhythme devices. However, it would be good to be able to do a diagnosis first, determine exactly where in the body the problems are, so that we know specifically which programs to program onto the devices. And this is where I want to go back to Dr. Reinhold Voll, who was the pioneer, if you like. You can call him the father of bioresonance diagnostics, because in the early 50s, he was a medical doctor. He developed electronic testing devices for finding acupuncture points electrically. And this was called the EAV testing, the electroacupuncture according to Voll testing. Now, at the time, there was no other way of identifying organ pathologies and organ weaknesses, where an organ may not have reached pathology, but subclinically was not functioning correctly. Now, this was a real breakthrough, because now by using a device that was measuring the conductivity of acupuncture points, and of course there are many acupuncture points all over the body. There's approximately 1,500 of them. So the Voll practitioners, they really had to learn each and every one of these points, and you can understand it was a very arduous process. It would take a long time to study to become a Voll practitioner, but by golly, if you really applied yourself and became a Voll practitioner, you were worth your weight in gold, because now you could tap in through the acupuncture points all organ systems. You could identify whether the organs were inflamed or whether they were degenerating, and the degree of inflammation and degree of degeneration. Now, that was a wow factor back in the 50s to be able to do that. Of course, it would be an arduous process testing each patient, because it would take many hours. But it gave a lot of information that was very useful for proceeding therapeutically to treat the patient. Subsequently, many other researchers have also verified the electrical conductance at the acupoints, which is actually significantly greater than the surrounding tissues. So when you actually touch an acupoint on a finger, let's say, the conductance there is actually greater than the conductance will be just a millimeter or two either side of that, just by touching the skin. So this was again a breakthrough to be able to identify these acupoints, which subsequently anatomists have actually dissected and have actually found that the structure of the tissues does differ in the acupoints compared to the surrounding skin. So there are anatomical as well as physiological differences in the acupoints. Then Voll began a lifelong research to identify the correlations between the disease states that he was seeing in his patients and the changes in the electrical resistance of the various acupuncture points. And he mapped this to perfection, whereby on a scale of 0 to, say, 100, he would be able to determine if it was around about the 50 mark, this was normal. If the conductivity increased, that was a sign of inflammation. If the conductivity dropped, that was a sign of degeneration. And he could go into any organ of the body and determine the degree of inflammation and degeneration by tapping into these acupuncture points on the skin. He thought that if he could identify electrical changes in certain acupuncture points associated with certain diseases, then he may be able to identify those diseases more easily or earlier when treatment interventions were likely to be more effective. And indeed, this is one of the big advantages of using bioresonance diagnosis, because if indeed you tap into an organ and you're finding that there is a weakness there, that doesn't necessarily mean that that particular organ has reached pathology. In other words, it's begun to degenerate and can actually be detected on medical tests. No, it doesn't mean that. What it could mean is that the metabolic functioning of that particular organ has begun to malfunction. So if nothing is done and there's no intervention, then of course, slowly, that organ will deteriorate and will reach degeneration. So by doing bioresonance diagnosis, it is possible to identify organ systems that are in the process of degeneration but haven't reached pathology yet. So we're able to tap into preclinical states and therefore practice preventative medicine by helping that organ system regain its optimal functioning before it actually reaches a state of degeneration and disease. And indeed, he was very successful, Voll, and he published much. And he found many of these points were indeed related to disease processes in specific organs. Before Voll began tapping into these acupuncture points diagnostically, they were actually used by, of course, Chinese medicine, which is at least 3,000 years old, for treatments, because when you're doing acupuncture, that's where you place your needles. You place your needles in the acupoints, which of course are talking or relating to those specific organ systems. Vold found, for example, that patients with lung cancer had abnormal readings on the acupuncture points referred to as the lung points. So on the lung meridian, there are acupuncture points that were showing that the conductivity was different, and he could actually, depending on the reading, diagnose lung cancer with a fair amount of accuracy. Now, there is more recent research by researchers from UCLA and UCS in the USA, where in a double-blind study, 3 patients with lung cancer and 20 controls, the controls had negative chest x-rays, had the electrical resistance of several acupuncture lung points and several small intestine points measured. Small intestine points do not relate to lung cancer. There was an 87% correlation between the testing results and the results of the X-ray diagnosis for the lung points, with no correlation with the small intestine points, because the small intestine points have got nothing to do with the lung. They have to do with other organ systems in the body. So this is a piece of research that is putting bioresonance diagnosis, if you like, into the evidence-based category, because with an 87% correlation, that is akin to the correlation that one would expect with an MRI scan or a CT scan or other similar medical tests. Of interest, there were no false negatives and only 4 false positives. False positive is when you are finding that the patient is positive for what you are testing. So, in this particular case, they actually found 4 times on the testing that the patient was positive for lung cancer, even though the X-rays per se were not showing a real sign of pathology in the lungs. But there was inconsistent shadows on the lung X-rays, even though this had not been confirmed by the CT scans and the tomographies. These false positive readings could have been lung cancer not yet diagnosed, or some other degenerative disease process, or they could have been merely incorrect readings, because we're talking about an 87% accuracy here. But the chances are that there was a degenerative process in the lungs that hadn't quite reached the pathology to be able to be seen on the other medical tests. Now, that was Dr. Vold, and we should really bow in honor to Dr. Vold, because he was the father of bioresonance diagnosis, and he spent decades researching systematically, patiently, with a lot of determination and passion to give us on a plate all of these acupuncture points and their relationship to diseases. However, in the early 70s, another famous researcher, Dr. Helmut Schimmel, he simplified the Vold testing by using only 1 point on the finger or the toe. So he would choose 1 point, as opposed to the many points that Vold diagnosticians would have to use all over the body. And he would factor in, against that 1 point, homeopathic ampules of diseased organs, for example, or nosodes of bacteria, or viruses, or fungi, etc. And if there was a resonant effect, in other words, if there was an indicator drop on the instruments, the bioresonance measuring devices, which are tapping into the autonomic nervous system, taking readings from the acupuncture points, if there was a conductivity drop, an indicator drop, then this would mean that there was a resonant effect. So, for example, let's say we have an ampule of a normal liver, a healthy liver, an organopreparation as they call it. And we are testing using the VRT testing, the vegetative reflex testing of Dr. Schimmel. We place the ampule onto the person, or we could place it onto a honeycomb which is connected to the bioresonance, the Bioresonance Diagnostic Device. If there's an indicator drop, then what that means is there's a resonant effect. Now, if my liver, for example, is healthy, then there would not be a resonant effect with the healthy liver. However, if my liver is unhealthy and I'm placing a healthy liver and checking the indicator drop, and there is an indicator drop, then that means there's a resonant effect, and so therefore there is something wrong with my liver. There is a problem with my liver. In the same way, if we were to take an ampule of a bacterium, let's say Staphylococcus aureus, if I don't have Staphylococcus aureus in my body, there would be no resonant effect. So if we take the conductivity reading from the Acupoint with the ampule of Staphylococcus on my body, and there's no indicator drop, then that means that I do not have Staphylococcus in my body. If there is an indicator drop, of course, I'm resonating, so therefore there are Staphylococci in my body. And by using this bioresonance diagnostics, we can identify basically anything that we as practitioners would like to ask of that patient. We can ask anything we like of the organ systems, so we can go through all the organ systems from the head downwards. We can ask whether there are pathogens, microbes, microorganisms in those organ systems that we are testing. We can also ask if there is inflammation in those organ systems, whether there's degeneration in those organ systems, and so on and so forth. So this is a very useful testing tool to be able to understand the pathogenesis of disease, to understand the causal chain. Why is this patient that is sitting in front of me presenting with these symptoms? What is behind these symptoms? What are the underlying causative factors? What other organ systems are related to the organ systems that are presenting problems? Because often we have eczema, for example, or psoriasis, but we have congested liver, and that is what is causing the eczema. For example, using bioresonance diagnostics, we can actually identify that congested liver, and moreover, we can identify what is congesting that liver, whether it's heavy metals or xenobiotics, or whether it's microbes, or whether it's related to a general congestion of detoxification organs, including the kidneys and the lymphatic system, and so on and so forth. So this is a brilliant way of really tracing the causal chain and the pathogenesis of disease, where the practitioner is in control of asking the questions, because as we will see in a minute, there are a number of automated devices on the market, and they're becoming more and more frequent. Many practitioners, they latch onto them because it's an easy way. You pay for the device once, you plug your patient in, the device does the work, the screening, the scanning, whatever it does, and it comes up with a myriad of different symptoms, different problems. And then, of course, the practitioner is faced with, how do we prioritize these, and how valid are these, and how reliable are these, and so on and so forth. As we will mention, in many of these devices, there has not really been research to validate and test the reliability and the validity of these automated bioresonance devices, as they are called. So after Voll's work, there were other researchers such as Dr. William Ray, who's written a lot. He was an MD from Dallas, USA, internationally known in the field of environmental medicine. And he began setting up double-blind situations using a number of people who had reacted adversely to a challenge test with various antigens, and for whom an optimum treatment dosage had been found to turn off these reactions. This was using like a homeopathic antidote, if you like, at specific potencies, which is one of the ways that we can actually turn off these allergic reactions. And it was truly double-blind, because nor the patient nor the instrument operator that was doing the bioresonance testing actually knew the correct dosage. And there were a series of different dilutions, different potencies that were tested. And the bioresonance device actually identified the correct optimal treatment dosage out of 12 to 20 different options in approximately 80% of the cases. Now that's phenomenal, because the combinations by chance of 20 different options are in the millions. So to actually identify with an 80% accuracy the specific potency, and the other 20% that was not diagnosed was within one potency away. So if the correct potency, for example, was 15C, the device would identify 14C. It was only one potency away, which of course is very easy to adjust. So all the misses were within one dilution or one potency of the optimum dose dilution determined by the trial and error, making it easy to find the optimum dose in those misses. In 1989, another researcher called Ali reported in the American Journal of Clinical Pathology the results of a double-blind test comparing the results of IgE antibody levels, which are usually what the immune system produces in an allergic reaction. And they used a microELISA procedure, which is a very standard medical procedure, biochemical procedure, for a variety of pollens and molds to bioresonance testing for the same antigen. So now that we're comparing the bioresonance testing with the ELISA testing, which is a very classic biochemical test which is used today. And the results showed concordance between the two tests of 73%. No test, no blood test, no ELISA test, no test in the world has 100% accuracy. So to have a 73% correlation is another wow factor, and it really does prove that bioresonance testing is indeed a very accurate way, and a non-invasive and a very economical way, of course, of tapping into the body and finding out a lot of information. In 1985, Kropp did another double-blind test comparing electrodermal screening, the Bioresonance Diagnostics, to sublingual and intradermal testing for a variety of foods, chemicals, and inhalants. And in 66% of the 227 tests, the Bioresonance Diagnostics, the electrodermal testing, identified exactly the same neutralizing dilution as did the intradermal and sublingual testing. The sublingual testing is when they drop various potencies under the tongue. The intradermal is when they punch the skin with different potencies, and they look out for the reaction. So here, bioresonance testing again had a nearly 70% correlation with these more sort of medically known tests. In 1984, researchers from the University of Hawaii compared 6 different diagnostic modalities for assessing food allergies. These tests included taking a history, food challenge tests, skin tests, RAS tests, IgE antibody tests, this is blood tests, and the bioresonance VRT test, the one that Shimon described, on 30 volunteers. The testing again was done in a double-blind fashion. The patients didn't know, the diagnosticians didn't know what antigens were being tested, and they found that the EAV, the electrodermal testing, or the VRT testing, vegetative reflex testing data obtained was comparable to all the other tests. And indeed, they found that in over 300 tests, the electrodermal testing matched the history 74% of the time, the food re-challenge test 77% of the time, the skin test 71% of the time, and the RAS testing 69% of the time. So here we're moving into a correlation coefficient approaching 0.75 or 75% accuracy. Now, one of the criticisms that we often hear, and I always make this aware, I always make practitioners that I'm teaching aware from the very beginning, is that the accuracy of the actual VRT testing equipment is pretty much 100%, because it is electronic components and it's testing conductivity. However, the experience of the practitioner is really what counts. Now, this shouldn't really surprise us, because if we compare, for example, a radiologist who's just completed their specialization, they're age 25, 26, 27 years old, and we compare their diagnostic capabilities using the same scanner with an experienced radiologist who's been doing this for 30 years, who do we expect to be more accurate in the diagnosis of the same scan that the two radiologists are looking at? Well, it's obvious that the clinician with the more experience is going to be more accurate, and it's the same here. I usually, when I begin teaching practitioners bioresonance diagnostics, I take in my bouzouki. It's a musical instrument that I play. I play them a couple of tunes, and then I ask them to play the bouzouki. It's the same instrument, so I'm giving them now the same instruments that they heard me play, and I ask them to play. And of course, they can't even find the chords. That doesn't necessarily mean that it's the fault of the musical instrument. It is obviously the lack of experience, lack of practice of the practitioner, the musician in this particular case. So to reach that level where I can play a couple of tunes on the bouzouki, obviously I had to sit down and practice, and I had to be determined, and I had to have patience, and so on and so forth. And this is what is required of bioresonance practitioners. They really need to apply themselves. But once they learn the VRT testing, not the vol testing, you don't need to go the vol way now. You just simply use one point on the finger, and you test various ampules or algorithms, because a lot of these ampules are now digitized, and they're all embedded in these modern devices that are available to us. Once a practitioner really reaches that level of becoming accurate on the bioresonance testing, they are worth their weight in gold, because they are few and far between, and the things they can ask about the causal chains and the pathogenesis of disease of their patients is ad infinitum. I always give the example to the practitioners I'm teaching. If I had to leave the Vinci Center and I only could take one piece of device, one measuring device, one instrument with me, because I had to go to a deserted island, what would I take? And the answer really is the Bioresonance Diagnostic and Therapeutic Device, which would be the data professional, for example, because the data professional gives me the potential to ask 20,000 questions of all the organ systems of the body, as well as the microbe loads of the body, as well as, you know, where there's inflammation, where there's degeneration, etc., etc. And it's all in one machine. And of course, once I've got that information, I can also use the same device for treatment. Now, previously, I had mentioned that there are, excuse me, let me just, previously I had mentioned many bioresonance devices on the market, and a lot of them are these automated devices now that a lot of people, practitioners I see are using. It becomes like a fad, and they do a little bit of training. It doesn't really take more than a weekend to learn these devices. The question is, how accurate are they? Where's the research to show that all this material that they're coming up with, you know, they may come up with, you've got various bacteria, you've got various viruses, you've got various fungi, but where's the research to cross-correlate what these automated devices are coming up with and other data? You know, whether that's blood tests or whether that's, you know, microbiological assays, whether it's other more researched methods of diagnosis using the bioresonance, the VRT, because these devices have been researched for more than 60 years now. So there's a lot of research, and you can see there's a lot of double-blind, placebo-controlled trials to show, you know, their reliability, their accuracy, etc. So with these devices, these automated devices, where is the research? That's the $10 million question. And when I ask this question of practitioners who are very enthusiastically using these with their patients, and then I ask them how do they prioritize all this data that it's giving them, etc. They seem to become Italians and use a lot of hand motions to respond without actually giving anything tangible in terms of hard data to back the efficacy of these diagnostic devices. So my personal opinion is that any serious bioresonance practitioner will want to be in control of the testing process in order to identify the pathogenesis of disease or the underlying causative factors. You need to be able to ask the questions. You need to be able to guide the device in what response it's going to give you by asking it the question that you as a practitioner want to ask. You cannot just leave the device to scan whatever it's scanning and then come up with a whole list, and then you take that at point blank and start treating the patient. I mean, often these devices and the practitioners that use these devices are not getting the success that a VRT practitioner would get using the standard VRT bioresonance diagnosis that was invented by Schimmel, and of course with Voll being the father before that. So Um, the best choice of VRT testing devices, these are the ones that rely on the Dr. Schimmel's vegetative reflex testing of one acupoint on the hand or the foot. These are the best choice for the serious practitioner that really wants to be in control of the diagnostic process. And there are many available. Some are more expensive than others, so it really does depend on what how deep the pocket of the practitioner is, because the price range is anything between sort of 8,000 and 35,000 or more. So, you know, it's the difference of walking to a car showroom and, you know, do you go towards the Rolls Royces and the Bentleys, or do you go towards the Hondas? Obviously, if you don't have that type of money, you're not going to go towards the Bentleys and the Rolls Royces. Having said that, of course, you know, a Bentley as well as a Honda is a car, and it will do the same job, basically. It does depend a lot on the experience, of course, of the driver. And here we are looking at the experience of the practitioner. So the recommended devices would be the Viga device, which is basically the one that Dr. Schimmel actually put together. The Viga technology is what Schimmel actually invented, and now we have the Viga Expert, which is top of the line bioresonance diagnostic device. The Bicom, which is another German device, that also has the capability of diagnosing as well as treating. The Viga Expert is only diagnosis. The Bicom diagnostic, it requires external ampules. There are no digitized remedies as there would be in the Viga Expert. So you have to, you know, add more expense to buying more ampules if you wanted to use the Bicom, but it does give you the advantage of having many hundreds of bioresonance therapy programs that you could use as well. And the Detroelis Pharma, which is basically a diagnostic device only, and the Detroelis Professional, which is both bioresonance diagnostics and therapy, and it can do many different types of therapies. It can do bioresonance therapy, electroacupuncture, electromagnetic therapy, color light therapy called quantum light therapy, etc. So these are the three devices, really. The cheapest of all these devices is the Detroelis equipment. And I think this is why we're seeing more and more professionals embracing the Detroelis technology, because the Detroelis Professional, for example, which is both diagnostic and therapeutic, is cheaper than the Viga Expert, which is only diagnostic. And you could buy four Deta Professionals for the price of one Bicom. So there's a big price difference here, and for the practitioner who really wants to spend one lump sum to purchase both a diagnostic and a therapeutic device with all the ampules or the digitized remedies, there's over 20,000 of them inbuilt, then the Deta Professional is definitely the one to go for. And here it is. This is what it looks like. Obviously, in order for a practitioner to get their head around this, they need to begin studying an online course called Energy Medicine and Bioresonance. If you email me, I can give you examples of. I can guide you of how to do this. You can find the actual course itself, the Energy Medicine and Bioresonance course, at collegenaturalmedicine.com. And there's a 5-day intensive clinical training, which is really hands-on to learn how to use this in detail, both the diagnostic side and the therapeutic side, and you will learn every single button on the device and what it means and how to use it, etc. By the end of that 5 days. The Detta Pharma is the diagnostic device. You can see a picture of it here. The Detta Pharma is only diagnostic. You cannot treat as such. And you can identify parasites, bacteria, fungi, viruses, organ imbalances, underlying causes of diseases, and so on and so forth. So, you know, there's a lot that you can do with this, and this also has 20,000 remedies, ampoules, digitized remedies that are in the device. So there's a lot that you can do with the bioresonance testing devices, discovering the pathophysiological processes that escape the standard clinical examination because they haven't reached the clinical stage, the stage of pathology. They're subclinical. You can determine the existence of focal infections, you know, whether it's tonsil infections, whether it's sinus infections, or indeed other focal scars. You can look at different organs, you can look at immune systems, you can look at food intolerances, allergies, testing of different drugs. You can even test whether natural supplements are effective before actually giving them to the patient. And there's a lot that one can do with these devices. So the only automated device that I would say stands out from the crowd of automated devices on the market, and I just wanted to mention this by name because personally I have tried and tested this, and I actually ended up buying it because I was very impressed with the capabilities and the accuracy of this. It is called the Metatron, and it was devised by Professor Nesterov from the Institute of Practical Psychophysics, which was founded in 1990 by the president of the International Academy of Non-Linear Diagnostic Systems. This is a non-linear diagnostic system. Unfortunately, we've run out of time because I did want to mention a few words on how this actually works, because it is fascinating. But from my own personal experience, and of course there is a lot of research to back this as well. In fact, they have gone to great lengths to correlate the findings with MRI scans, CAT scans, blood tests, patient histories. I mean, they have really gone to a lot of depth to cross-correlate. And what can I say? The accuracy of identifying degeneration in the body is uncanny. That's the only thing I can say, because having placed patients that I know their history, and I have all their scans, their medical history, their blood work, and more, and for this device to actually find it, and it keeps on repeating it, and it is reliable, because if you put the patient on it again and again and again, it will just keep on finding it. It really is an amazing system. So this is the only automated system that I would bow to at this stage. The others really need to do the homework, and I'm not against any manufacturer. I have no personal gains in selling. I don't, not a distributor for Metatron or any of the other devices. It's just that as a scientist, I like to see hard data. I like to see some proof. My middle name is Thomas. I need to see the data. And unfortunately, a lot of these automated devices, with the exception of the Metatron, do not have that hard data. And hopefully, the manufacturers that have gone to great trouble and expense to actually get them out on the market can perhaps revisit some of that research, and we could possibly help them design methodological scientific studies to be able to do that. So time is running out. I just will summarize that these are the list of bioresonance diagnostic and therapy devices that I would recommend. The Vega Expert is the diagnostic, the Vega Select is the therapeutic, the BICOM is the diagnostic and therapeutic, but it's a bit of a Rolls Royce, it's quite expensive. The Data Professional is both diagnostic and it is therapeutic, and a very reasonable price for the package that you get. And the Data Pharma is only the diagnostic, again, that is extremely reasonably priced for the diagnostic sides of bioresonance. So we've really come to the end, and I apologize for going about 10 minutes over this time. I hope you've enjoyed it and learnt more about bioresonance diagnostics, at least, and the complexities of the topic. A lot of practitioners, I get a lot of emails, I get a lot of calls from practitioners who are really quite confused, and this is why I took the opportunity of actually putting this video together, maybe to help some of those practitioners start doing a little bit more focused research to make their decisions before they dive into the field of bioresonance diagnosis and therapy. Thank you very much for listening again, and we'll be back together